let's look down the road 3 months. There'll be about 5,000 campuses across the country trying to welcome 20 million college students, 100,000 public schools welcoming 50 million students. What would you say to the chancellor of the University of Tennessee, Knoxville, or the president or the principal of a public school about how to persuade parents and students to return to school in August? Let's start with treatments and vaccines first, Dr. Fauci. And if you could save about half of my 5 minutes for Admiral Giroir for testing, I would appreciate it.
Thank you very much, Mr. Chairman. Well, I would be very realistic with the chancellor and tell him that when we're thinking in terms...
It's a her in this case.
Oh, okay. I would tell her, I'm sorry, sir, that in this case, that the idea of having treatments available or a vaccine to facilitate the reentry of students into the fall term would be something that would be a bit of a bridge too far. As I mentioned, the drug that has shown some degree of efficacy was modest, and it was in hospitalized patients, not yet or maybe ever to be used either yet as prophylaxis or treatment. So if the issue is that the young individuals who will be going back to school would like to have some comfort in that there's a treatment, probably the thing that would be closest to utilization then would likely be passive transfer of convalescent serum. But we're really not talking about necessarily treating a student who gets ill, but how the student will feel safe in going back to school. If this were a situation where we had a vaccine, that would really be the end of that issue in a positive way. But as I mentioned in my opening remarks, even at the top speed we're going, we don't see a vaccine playing in the ability of individuals to get back to school this term. What they really want is to know if they are safe. And that's the question that'll have to be due with what we discussed earlier about testing. So I'm about halfway through the remarks. I'd like to just pass the baton to Admiral Giroir, who would address the question of the availability of testing and what role that might play in returning to school. Thank you, sir.
Well, thank you, Dr. Thank you, Dr. Fauci. And Admiral Giroir, you said that while we're doing about 10 million tests this month, that we might be as high as 40 or 50 million by September, and a month, which is a significant increase. So if I'm chancellor of the University of Tennessee, could I develop a strategy where I'd say to all my students, we have, for example, an antigen test, which is quick and easy. You want everybody on campus to come by and take it once before you begin school. That will at least let everybody know that on that day we've isolated anybody who's positive, and then we can continue to monitor. Is that strategy possible in August and September?
So thank you, Mr. Chairman, and I may reserve 20 seconds for Dr. Redfield as well. The strategy that's going to be employed really depends heavily on what's the community spread at that time. If there's almost no community spread, your strategy will be different. If there's high community spread, it will also be different. But yes, technically, we will have the ability, and your chancellor will have the ability. We expect there to be 25 to 30 million point-of-care tests per month available. It is certainly possible to test all of the students, or it is much more likely that there would be a surveillance strategy done where you may test some of the students at different times to give an assurance that there's no circulation. That would be done in conjunction with the CDC and the local health department. There's also strategies that are still needing to be validated, but of pooling samples. We know in some experimental labs as many as 10 or 20 samples can be pooled. So essentially one test could test 20 students. And finally, there are some experimental approaches that look interesting, if not promising, that, for example, wastewater from an entire dorm or an entire segment of a campus could be tested to determine whether there's coronavirus in that sewerage, the wastewater.